Yeah, we know the mode of getting these viruses through what we call contact, not contact. Touching any body fluid from the person that is infected with this virus. Body fluid, sweat. Including sweat. Sweating.
Yes.
If you touch body with sweat, urine, stool, we call it feces, of the, even conjunctival secretion.
From the eye.
From the eyes of the infected person. Somebody who has the virus, if they vomit, if you touch their vomitus and they cough, you touch their cough, the coughing, whatever they cough out, you can get the virus from them. So the same thing go with the dead body. Any secretion from their body, their blood, bleeding, if you touch, you can still get the virus from it. Yes. That is because those are the major mode of transmission that you have to, even if somebody has the virus, not dead now, somebody who has the virus is not dead, if they touch a table like this and you come and touch that table, you can still get the virus. Nothing but contact transmission. So
you mean like with sweaty hands?
Sweaty hands.
You put it on the chair and you touch the door handle.
Yes. And you touch the door handle, especially much more if you have any scratches,
any exposed skin.
You have previous scratches or any trauma to your skin, yes, the virus can be transmitted through that contact.
Wow. Unfortunately, they say healthcare workers are most at risk here. So what valuable precautions can you suggest?
Healthcare workers are at the greatest risk for the fact that we are the ones that are constantly exposed to these patients. And if the patient comes in, if Ebola virus is not suspected, and the proper precautions are not taken, knowing that this virus can be acquired through simple contact of the patients, the skin, the utensils they have in the room, the material we use, like blood pressure cuff, temperature thermometer we use, that we constantly touch. We are the one that constantly touch, but yes, the healthcare worker is the biggest problem because we are the one that constantly exposed to this patient. Unless we take proper precaution when they come in by suspecting this Ebola virus and take proper precaution. What do I proper precaution means? If somebody has Ebola virus, even though we know it's through contact, we still have to go through proper precaution. Meaning, number one, when the Ebola virus patient comes in, we need to wear gown, which we call gown, specialized gown, not white gown. Specialized gown. We need to wear gloves. We need to wear mask. If we have to do any procedure on the patient that can cause splashes and procedure, we need to wear goggles also. So in case the body fluid splash to the eyes, that can be prevented. Splash to the mouth, we are wearing mask, we need to wear, and we have to take, second thing is not just wearing these gloves, gown, mask is the answer. There's a specialized way of removing these gowns and gloves from us, which we have to also follow. Otherwise, if you just take out the gloves in your hand from one and touch the other hand with the other gloves, you can get the virus.
Pick it as well.
So there's a specialized way. That's where we are the ones that are much more in danger with this virus, because we are the ones exposed to the patient.
One of the interesting things you spoke about earlier, you said from the moment the Ebola patient comes in, there are precautions to take. What if, and I'm imagining now walking into a private clinic, they don't know at that stage, even when you're getting your card, nobody knows at that stage that you have Ebola virus. You are probably going to the hospital because you think you have malaria. So, the receptionist gives you a pen with your sweaty hands, you fill the card. The issue of Ebola will not arise until probably much later. So how do we get around this initial thing without sending everyone into a panic now?
Yes, it's true indeed that presentation, it mimics, these will mimic other viruses. Like I said earlier, flu, malaria, typhoid can be mimicked by this virus. But simple questionnaire, like you say, before you start giving any patient who comes in pens and papers to write, I believe there should be questionnaire should be developed.
Yes.
Such as symptomatology. What symptoms did you come in with? Someone who comes in with fever, headache, muscle ache, joint ache, vomiting, diarrhea, I would say that person should not be given until the outbreak is gone.
Yes.
Should not be given a pen to write. We should suspect. It should be suspected,
Right.
and they should not be given a pen. Even if they give a pen to write, that pen should not be used by other persons.
And within 2 to 21 days,
Yes.
you will know that there's something wrong.
99% of the time you will know within 20, because those are incubation period, you will know, yes, that you've been infected with this Ebola virus.
Should we all be going around with gloves now and face masks?
That's a good question. The answer is no. You know, the way to prevent this virus from transmissibility
Yes.
from one person to the other is just proper education. If you are exposed to somebody, if you have a family member, let's take for a family member now, who has Ebola virus, the advice would be try not to touch secretion of that person. Do we need to wear face masks, everybody, and do we all need to wear gowns and gloves because
yes.
of this Ebola virus outbreak?
Yes.
The answer is no, for the fact that we don't wear face masks for people who have tuberculosis, or everybody. If somebody has TB, yes, they need to have face masks themselves.
Yes.
But
when they cough.
When they cough into that. We don't wear face masks. But if you suspected somebody has Ebola virus, my advice would be, if suspected, family member or classmate or roommate or co-workers, if you suspect they have Ebola virus, my advice would be thorough washing of hands. You don't need to wear face mask or gloves, but make sure you wash your hands thoroughly after you get close contact with that person.
Okay. Counting down 60 minutes with Dr. Tajuddin Agbara. He's a lecturer in infectious diseases at the Midwestern University, Illinois in the United States, and a board-certified infectious disease specialist licensed to practice in the states of Illinois and Indiana.